All right, well, believe it or not, more than 15 million Americans are actually suffering from acid reflux disease, also known as gastroesophageal reflux disease, or better known as GERD. Now, this is a case where the acid from the stomach flows up and into the esophagus, causes all kinds of discomfort and inflammation, and sometimes, if it's chronic, scarring. Now, GERD is a digestive disorder. It's a motility disorder that's diagnosed when this burning happens very frequently or even on a continuous basis. Now, the reversal of flow of acid into the esophagus takes place when there's a problem with the lower esophageal sphincter. This is a valve between the esophagus and the stomach. Instead of food obviously being pushed down the esophagus and into the stomach and staying there, what happens is the food and the acid actually reverses back up and pushes back up. And if this is happening to you, stay tuned, because there's a lot to learn here. Well, hey there, I'm Dr. Hagmeyer, and if you or a loved one is tired of dealing with acid reflux and GERD, and you really want to learn about some of the root causes behind your symptoms, or you want to know how you can naturally treat the symptoms of acid reflux and that acid taste in your mouth and GERD, be sure that you watch both videos in this series, because I really want to help you understand the different reasons behind that burning in your stomach, behind all that belching and bloating and that acid taste in your mouth. Now, in this video series, I also want to share with you 7 natural tips and treatment strategies that can naturally bring relief without causing all the side effects that proton pump inhibitors or antihistamines, which are H2 blockers, cause. So just as a reminder, again, make sure that you watch part 1 and part 2 of this series. Now, if you're already taking medication, again, whether it's a proton pump inhibitor like omeprazole, which is Prilosec, or Nexium, or you're taking some sort of H2 blocker, antihistamines, these are things like Tagamet, Pepcid AC, and the new Zantac 360. That's okay, because these things that I'm going to go through and I'm going to share with you are still very incredibly effective at calming down your digestive system so that you can decrease your dependency on these acid blocking medications and hopefully get you off them, right? Now, I'm often asked by people who have GERD and acid reflux why histamine blockers, or proton pump inhibitors for that matter, aren't the answer for acid reflux. Why am I so against them? So there's a couple reasons, right? But here's the thing. Proton pump inhibitors, when we look at the list of the side effects that they come with, they cause headaches, they cause rashes, they cause dizziness, they cause nausea, they cause abdominal pain, they cause gas, they cause constipation. And if you take them long term, you take them long enough, right, they can cause chronic kidney disease, they can cause bone fractures, they can cause dementia, they can cause pneumonia, they can cause vitamin B12 deficiency, they can cause amino acid imbalances, and they can cause diarrhea. But the second reason, really the most important reason that I believe that these medications, why they're a problem, is that they don't address the root cause of your acid reflux and GERD. And what happens is this snowballs into health problems that obviously are much worse. So even if you take medications to block acid production in the short term, it isn't a real solution. And over time, these medications worsen your nutritional status. They worsen your digestion. They worsen your motility disorder. Again, when your digestion is healthy, your stomach produces hydrochloric acid, or HCl, and that helps acidify the stomach. And this is very, very important, because pepsin, which is an enzyme that breaks down protein to amino acids, only works in an acidic environment. So when HCl production is low, or the pH of the stomach becomes more alkaline, your pepsin doesn't work, it doesn't get activated, and then you have problems digesting protein and breaking down and using amino acids. And this happens often enough, your stomach attempts to release even more acid, which is what we call acid rebounding, right? And this can also happen when you take antacids, even over-the-counter things like Tums, which again neutralize the acid in your stomach. That's not a good thing. Now, unfortunately, using these acid-inhibiting medications such as proton pump inhibitors or H2 blockers like Pepcid AC and Zantac and Tagamet, these medications can cause a state of hypochlorhydria, or chronic low acid. And again, this perpetuates the cycle of indigestion and poor protein digestion without providing relief for the underlying cause of your symptoms. Even if medications that you take block the acid production, it only helps in the short term and really makes you feel better, but long term, it's not a solution. And over time, like I said, it can actually make your acid reflux and digestive problems much worse. So instead of masking your symptoms with H2 histamine blockers and proton pump inhibitors, it makes more sense to investigate what's really causing your GERD and what's causing your acid reflux. All right, and so let me give you some common causes of GERD and acid reflux that, to be quite honest with you, most GI doctors or your GP didn't even check for. Again, these are things, there's a list of them, but I want to go through them with you because these are things, unfortunately, that I see very often in my office every day. Number one is atrophic gastritis, right? This develops when the lining of the stomach has become inflamed for several years. The inflammation is most often the result of a bacterial infection caused by H. pylori, or otherwise known as autoimmune gastritis is another issue, a chronic inflammatory disease where there's destruction of the parietal cells of the part of the stomach called the corpus or the fundus. And the known consequences is, of course, a B12 deficiency and consequently something known as pernicious anemia. Okay, so number two is a hiatal hernia. Now, when the lower esophageal sphincter and the stomach wall below it bulges up through the opening in the diaphragm, it allows the acidic contents of the stomach up and into the esophagus. The larger the hernia, the greater the acid reflux. And again, this is usually only going to be detected on a chest x-ray, but usually an endoscopy. Number three is obesity. Extra weight increases the pressure on the lower esophageal sphincter so that it stays open. And when it stays open, it allows the stomach acid to reflux into the esophagus. Number four is a loss of muscle tone. The lower esophageal sphincter can lose its tone and its mobility as we age, making it more likely for the contents of the stomach to push up through the weakened valve. And some studies actually show that stomach acid levels also naturally tend to decline as we age. So as that HCl stomach acid levels decline, your ability to digest protein and other foods is compromised, and then you develop acid reflux. Number five is prescription medications. These are going to include things like anticholinergic. These can be medications that people are prescribed when they actually have been diagnosed with a motility disorder like irritable bowel syndrome or chronic diarrhea. These medications, again, can affect peristalsis, which is that muscular wave-like contraction that, again, is pushing food and waste down and out. Instead of food and waste going down and out, here again, it refluxes up into the esophagus. And again, medications used to treat chronic pain, like codeine and other opiates, they can slow down the action of smooth muscle tissue, and that can affect the lower esophageal sphincter tone. Another medication that we have to be aware of are antidepressants, especially tricyclic antidepressants. Remember again, motility and digestion is under the control of neurotransmitters. And again, many of these neurotransmitters in the gut work on the brain as well as the muscular contractions of the gut. So again, there's a video that I did. You can go back and watch that video on motility and digestion. Other medications that are important to be aware of is antibiotics, birth control pills, medications that women are put on for osteoporosis. These are known as bisphosphonates. Number six is thyroid disease, and that includes Hashimoto's disease, right? Thyroid disease affects every aspect of digestion and motility, and stomach acid is no different. Hypothyroidism contributes to hypochlorhydria, again, a condition in which the stomach acid is too low. And again, for someone with acid reflux or chronic indigestion and belching and bloating, this may sound like a good thing, but in fact, low stomach acid actually causes heartburn, and it causes indigestion, and it causes GERD. Hashimoto's disease, this is an autoimmune disorder that attacks the thyroid gland. Again, it's common for a person with Hashimoto's disease to also have atrophic gastritis, a pernicious anemia. And again, this is an autoimmune motility disease. Things like celiac disease and things like leaky gut. Number seven is small intestinal bacterial overgrowth. This is a condition where now you have an overgrowth of bacteria in the small intestines. Again, this is often overlooked in patients with acid reflux, but again, multiple studies show, and we see it all the time, that SIBO, or that bacterial overgrowth, and GERD are connected. And again, each can be causing the other. Now remember what I said earlier about stomach acid, right? I said stomach acid also plays a role in keeping bacterial populations within the stomach and the small intestines in check. And if you have poor stomach acidity, the small intestine loses its acid and base ratio. This allows bacteria to colonize in the small intestines. And when this happens, you develop bloating and you develop belching and you get gas and you get acid reflux. In many cases, you'll experience diarrhea or constipation. I already said hypochlorhydria, but it's worth mentioning again. This is low stomach acid. Again, if you don't have stomach acid, you can't digest food, you can't activate those enzymes, you can't absorb nutrients. And this again leads to indigestion and heartburn and GERD. And very importantly, it leads to malnutrition and bacterial overgrowth. Remember, heartburn and GERD is a condition caused by low stomach acid production, or when the pH of the stomach changes to become slightly more alkaline. Now, the majority of the time, it's not too much acid that's causing this problem, it's insufficient acid production. Okay, so keep that in mind. Number nine are food allergies and food intolerances. Believe it or not, if you suffer from gas, bloating, acid reflux after meals, you may be dealing with either a food allergy or a possible food sensitivity, right? There's more to acid reflux than just so-called spicy foods causing that heartburn, right? If you have food allergies or food sensitivities, stomach acid may not be able to break down the proteins or the carbohydrates or the sugars in the foods that you're eating. And again, this leads to issues. Number 10 is alcohol and tobacco. Smoking can decrease the pressure in the lower esophageal sphincter, while alcohol delays gastric emptying. And what that means is that food sits in the stomach rather than being digested. Alcohol and tobacco also lower the pressure of that sphincter we're talking about, that lower esophageal sphincter. And again, this is like a trap door between the esophagus and the stomach. If it doesn't stay shut and it stays closed, food and acid can regurgitate back up into the esophagus. Now, I gave you about 8 reasons in my last video on digestion motility why alcohol needs to be avoided when you have digestion motility issues, right? Lastly, I want to talk about stress, right? Don't be so quick to shrug off the effects of stress and how it impacts acid reflux and GERD, right? When you're stressed out, think about it like this. When you're stressed out, your body produces more of a stress hormone known as adrenaline and produces something called cortisol, right? Now, high levels of these hormones really shut down motility and they shut down digestion. Your body's now in this fight or flight state rather than in a rest and digest state, parasympathetics. Stress also thins out your gut barrier, promotes hyperpermeability in the gut, also known as a leaky gut. And people who have a leaky gut, again, are more prone to allergies, more prone to food sensitivities, more prone to inflammation, and more prone to motility disorders, right? And so when you have elevated cortisol, that inflammation and that leaky gut will predispose you to acid reflux and just about every other motility digestive symptom that you can think of. Stress hormones are a vital part of life, but when they become dysregulated, just about every organ in the body is going to be negatively affected, and especially when it comes to digestion. So what do you do if it turns out that you have one or more of these problems causing or exacerbating your symptoms of GERD and acid reflux? Well, you're going to have to tune into the next video because in part 2, I'm going to go through 8 things that you can start doing to really start helping improve your symptoms. Now, if you have questions or comments, feel free to drop those in this comment section below. But if I was you, I would make sure that I check out part 2 of this video.